Chapter 32, Women's Healthcare Continued. Menopause means the stop of menstruation, and your book defines it as 2 consecutive months without menses. But you can find other resources that say a woman has to go 12 months without menses. For testing purposes, we'll use the consecutive 2 months, but want you to be aware because most other sources do use 12 months. One of the key factors we need to educate on is once a woman has reached menopause, she needs to report any unplanned vaginal bleeding because it's highly suggestive of endometrial cancer. Age varies when menopause occurs, but it's common between ages 45 and 50. During perimenopause, the ovaries are less fertile and pregnancy is harder to achieve. The woman can experience less vaginal lubrication, which can cause painful intercourse. A lack of estrogen can cause atrophic changes in the bladder and urethra, which basically means she loses tone and can have some stress incontinence. Hot flashes are common finding as well. They tend to be more frequent at night, which can also cause fatigue from having interrupted sleep pattern. Psychological responses can vary between women. Some women are happy they can no longer conceive children, while others grieve this issue. Depression, mood swings, irritability, and agitation can occur, but no reason why these occur is noted. Insomnia and fatigue are common as well. There's just no rhyme or reason why some women can experience all the changes and some are very severe, and the next person may only have a few and are very mild. Therapy includes managing of the symptoms. Many women just deal with the symptoms and don't seek out any medical treatment. Hormone therapy used to prescribe, but much research was done and is not as effective treatment for many due to the increased risk of certain cancers. Nursing considerations include education on the effect of perimenopause and menopause. If the woman is choosing hormone therapy, then we must provide education on the importance of compliance and the risk and side effects that can occur. A few non-drug choices include using a water-soluble lubricant to help with painful intercourse, providing education on Kegel exercises to help with muscle tone of the pelvic muscles, drinking at least 8 glasses of water a day to help decrease the concentration of urine to help decrease bacterial growth. Osteoporosis is one of the greatest risk concerns for postmenopausal years. Predisposing factors include a family history of the disease, late menarche, early menopause, and a sedentary lifestyle. Also, women who drink alcohol, smoke, or consume excessive amounts of caffeine are at risk. Corticosteroids and some anticonvulsants will also increase the risk. It is known as the silent thief because it takes place gradually over the course of many years without symptoms. The first signs that are noticed are the loss of height and back pain that results from a collapsed vertebrae. Next, the Dowager's hump occurs when the vertebrae can no longer support them. The abdomen will start to protrude and the loss of the waistline as well. The major goal is to prevent osteoporosis. There are different medications that can be prescribed to help prevent osteoporosis. There are different medications that can be prescribed to help reduce the risk. Calcium does not prevent bone loss, but other therapies will not work as well if there is a deficiency in calcium. Vitamin D is necessary for the absorption of calcium. Weight-bearing and resistant exercises have been shown to increase bone density and build muscle mass for the women. High-impact exercises should be avoided. Swimming or water-based exercises improve cardiovascular and respiratory maintenance while helping with weight control, but they do not limit bone loss. 30 minutes of exercise daily is recommended. Nurses can help educate on the proper nutrition and proper dietary guidelines. They can also educate on proper exercise and educate on reducing the risk for falls for the women who are at risk. Candidus is also known as a yeast infection caused by a change in the vaginal pH, which will increase the growth of bacteria. This change in the pH occurs with pregnancy, diabetes, oral contraceptives, and systemic antibiotics. The main symptoms include itching, and some can have pain with urination. Treatment can be prescription or non-prescription medications, and typically your treatment is 3 to 7 days depending on the medication. Women should seek medical care for the first infection or if she has recurrent yeast infections. There are a variety of sexually transmitted diseases that can occur. We'll discuss a few of the more common ones. Some can be transmitted via sexual activity, so being sure to educate the woman and her partner on treatment measures is needed. Trichomonas is a protozoa that thrives in the alkaline environment. Symptoms include a purulent vaginal discharge that is thin or frothy, malodorous, and yellow-green or brownish-gray. Treatment includes metronidazole or indazole, and they need to avoid alcohol when using these medications. No intercourse until treatment is completed. All partners need to be treated as well. Bacterial vaginosis does not have a known cause, but tissue damage and vaginal intercourse can be contributing factors. The main symptoms include thin, grayish-white vaginal discharge that typically has a fishy smell. Intercourse should include a condom. Treatment of the partner is not beneficial. Chlamydia is a high in sexual activity teen and young adults. They many times can be asymptomatic in men and women, so diagnosis can be difficult. The women may have a yellowish vaginal discharge and painful urination. If it's untreated, it can move from the cervix up to the fallopian tubes and is the main cause of tubal scarring that results in pelvic inflammatory disease known as PID, infertility, or ectopic pregnancy. Treatment includes azithromycin or doxycycline. Treatment of all sexual partners is needed to prevent further spread. Use of condoms should be a priority until a cure is established. Gonorrhea is an asymptomatic in women, but if they do have symptoms, it's usually purulent discharge, dysuria, and painful intercourse. It's also associated with PID, which can increase the risk for infertility or ectopic pregnancy. Treatment will include treating for the chlamydia drugs as well as ceftriaxone or cefamixine. All sexual partners need to be treated as well and intercourse avoided until it's cured, and the use of a condom until it's cured as well. Herpes genitalis is caused by the herpes simplex virus known as HSV. Within 2 to 12 days after the primary infection takes place, vesicles appear in clusters on the vulva, perineum, or perianal areas. These lesions can cause great vulvar pain and tenderness and painful intercourse. The lesions can also occur on the cervix and the vagina, or in the vagina. The vesicles rupture in 1 to 7 days, and they form ulcers which take 7 to 10 days to heal. Once the symptoms are gone, the virus lies dormant and can return, especially in times of stress. No cure is available, but antiviral meds, aciclovir, can be used for treatment. No sexual intercourse while lesions are active. HPV are small wart-like growths that can resemble cauliflower. Common sites are the vagina, labia, cervix, and perineal area. There's an association between certain forms of HPV and cervical cancer. The goal is to remove the wart, and this can be done by certain topical medications, or they may need cryotherapy, which basically uses cold to freeze off the warts. Even with these treatments, she can still have reoccurrences. All sexual partners need to be treated as well. Sexual intercourse should be avoided until all lesions are healed. There are vaccines out there to reduce the occurrence, but there's a lot of controversy regarding the safety of these medications, so many are not choosing to vaccinate against HPV. Nursing considerations include education on the prevention of STDs. We must teach signs and symptoms, explain the testing procedures, and the treatment guidelines. Pelvic inflammatory disease is known as PID and is an infection of the genital tract and causes chronic pelvic pain. The primary sources are the bacteria that causes STI, including chlamydia and gonorrhea. The bacteria can cause an inflammatory response, which in turn can cause scarring of the fallopian tubes and pelvic cavity. Some women experience very few symptoms, while others have pelvic pain, nausea, anorexia, and irregular vaginal bleeding. Therapeutic management includes treatment of the symptoms. If a woman is having a serious infection, she may be febrile, have abdominal pain, and leukocytosis, and may be admitted to the hospital. They are treated with IV fluids and antibiotics, and surgery may be needed if she develops an abscess. Outpatient therapy works for most women. Nursing considerations include education on ways to prevent STIs and educating on limiting the number of sexual partners and avoiding those that have multiple partners, and also the importance of using condoms to reduce the risk for STIs. Also, another sign and symptom they need to report to their provider, and if any symptoms occur, to contact the provider right away.